morning. Thanks for stopping by, breathing through, and seeing your friend Christine. I've decided to utilize my time more effectively. I have a little thing I use when I drive and have to eat breakfast on the way to work. So, one of the things that I thought I'd maybe put on a video is things to help you motivate yourself. And there's my dog back there, by the way. And speaking from my personal experience, I've had a lot of loss, and meaning situational loss, loss of roles, loss of people, and he's got some health issues, and so he gets to come with me to work, and he inspires me to keep going. And what inspires you? So, does fear inspire you, or does it halt you? One thing we haven't been trained to do is harness the energy of something we don't like and channel it into what we do. So, say you're in fear of what might happen, the unknown. I've got this situation, I don't know how to manage it, I don't know how to get through it because I haven't experienced it before. Go inside of yourself versus looking out. So part of why I put this channel together is for you to access the information I have to share for healing and prevention. So utilize it for yourself. So take any fear you have and find a video and work on yourself. Take frustration and anger and find a video on my channel and exercise and work through those emotions physically, or if you find you need more calm in your life because your mind is racing, you're not sleeping, you're not able to just stay focused on something, you're forgetful, focus within. So I have a lot of different playlists because I work with a lot of different types of situations for people, and to me it's quite interesting to help you navigate through something like a stroke, heart attack, fractures, falls, head injuries, sports injuries, computer-related overuse syndrome of the hands, all the way up to the shoulders, pain, lots of pain people have, and it might be emotionally related or physically related. So I told some people recently I would discuss the pain neuroscience, and this is newest research of neuropain science. So what they know now is, be careful, someone's on my tail here going fast. So that's right there. This is a presentation of how to have alternating attention, which is also what I work with people. How do you pay attention to something and then your attention's diverted, and then how do you get back? You take a breath. Just take a breath. So, pain, question for you. Pain, does it come from the body to the brain, or does it go from the brain to the body? Pain comes from the brain. Really? People say, no way. Yes. What they know now is our nociceptors, which are the sensors in our body, and this is combining education and research from the 90s and before. Oh, here he goes. Someone's passing me. So you gotta let people just go by you. Yep, there's another one. Woo. And they're going like 15 over the speed limit, maybe more. So you just allow, by the way. That's a sidetrack, just allow people to do what they're gonna do. Some people get angry and try to speed up and tell them, don't, come over, and that's, oh, by the way, it's easier for someone to be in front of you who is impatient and frustrated and angry than behind you. So just, that's what I allow. So I can see them versus them being on my tail. Okay, sidetrack. This is how you do it. This is how you get back to what you were thinking about. Breathe. So we have 6 nociceptors in our body. They're all for pain. And why? Because we're genetically set up for survival. But it's from way back in the primal age of the lion coming after us. But lately we don't have lions running after us, do we? Humans usually are the ones doing something. And it's kind of unnecessary, actually. We're in the best part of our existence right now. We have so much accessible to us. So why are we in pain? So going back to the brain, information comes from the body and goes up to the brain, and it's in a danger message. Danger is how it presents. Different types of danger. So a pressure danger, a sharp danger, a hot danger, emotional danger. That's actually from the brain. So then the information goes up to the brain, and the brain decides, do I send pain or not, based on the feedback I'm getting. So if you're someone who's got a new injury, that's an acute injury, they usually should heal within 3 to 6 months. If you're someone with a chronic pain syndrome, meaning past 6 months, that's a brain thing. The brain's in a cycle. Because somehow you've become used to it, and like, this is life, I should be hurting. And it's not. You shouldn't be hurting chronically. We're not meant to. So what I help people with is how to get out of that cycle. So I'll give you some more information that can help you. So we now know every 2 days our sensors of our body in the chemical level, in the cellular wall level, change. What does that mean? I'm trying to make it simple. The neuroscience is not simple on a chemical level. It's a lot of details. So say that there's a change in your environment that you don't want. A loss of a job. Someone's sick. You're sick. Your dog's sick. The weather changed and you didn't prepare for it. There's an emotional stressor from something. The brain will take that and send down pain, because the things that impact us are not just on a physical level, but on an emotional and thought level. So then, for the people who are in chronic pain, they're always expecting it. They don't want to move anymore. Like, I'm not moving that arm, I'm going to hurt it, right? So if you've had a 30-year or 50-year chronic pain issue that no one can find what's wrong, this is where the answer is in the change of perspective, the knowing what to do. It doesn't necessarily have to be pills. How about some ideas for you? Okay, so say you have a shoulder issue or a hip issue, and you're thinking, okay, that came from 1995, and it's still a problem. What the brain has done, because of now this hypersensitivity loop between those particular joints and the brain is it shuts off blood flow. Yes, the brain will do that. It's like, okay, I've gotten enough pain messages for my whole life. I'm going to send down pain, and you're not going to use that joint anymore. And now you're going to have less blood flow, and then you're going to have pain. So what do? Rub it. That's like, ancient information. That's, secrets from your mom or your grandma. You rub the area because it brings blood flow. You bring attention to it. You say, you're okay. I've got you. You don't have to hurt anymore. Literally out loud, say this to your body. Because you're your own healer. You've forgotten how to be your own healer, or maybe you were never taught. You were taught it's always outside of us. Let's go see the doctor, go see the nurse, and go see the therapist, and go see the massage therapist, and go see the different doctor, and then you're like, pain doctor, and you're just like, this is never going to stop. There's nobody who can figure this out. It's in you. You've got the power. You just didn't know. So, rub the area. Heat. This is heat, right? When you rub something, it gets warm. And then you're aware of it. And then you get maybe tingles down the arm. As far as like awareness, like it wakes it up. Move it. Start moving it again. Oh, ow, it hurts right there. Okay, rub it right there. Rub it at that spot. The brain senses motion and decides if there's pain. The brain senses a temperature change from the body and decides if there's pain. The brain senses fear from the mind of moving to have pain, which is guarding. Because if you've seen people who are in pain, they walk really super stiff. Because everything hurts when they're moving. And it's then frustrating, and it's this cycle. What about a hot bath? A hot shower? Do you feel good after that? Then you're going to tell your body and your brain, this is how I can feel. And then you're going to move after it. Move. But no, every 2 days you can change it. Okay, look into the nutrition too. So if you haven't already learned about it, which took me a long time, nightshades are potatoes, tomatoes, eggplant, and peppers. If you're someone who has joint pain, you want to pull those off your diet. It's called an elimination diet, where you pick something and you don't do it for like a month and see how you feel. Because really, you're your own body. Like, you're in this body. Focus on you. Spend time on you. Be curious. Does this work? A lot of people roll their eyes and, I don't want to change. Why not? Why not try this? If you have this knowledge, use it. Pull off of the tomatoes that you've been having. See if you have less pain. The lectins in tomatoes, the peels and the seeds, inflame the joints. Try that. Try pulling off of the nightshades. If you want potatoes, pick yams, sweet potatoes. Those are good for us. They don't have the inflammatory response in the joints. Add avocados to your diet. There's a lot of omega-3s in them. And they're good for the GI, the gut. They're good for the brain. You want to really heal from inside out and outside in with awareness that every 2 days you can change the pain loop. And then if you have pain all of a sudden, there's usually a trigger. It's not just random. Maybe your thoughts about something, ruminating is the term in psychology, when you just go round and round, expecting the worst. You're ruminating, you're stuck. Cut that down. Do a meditation in here. I have several meditations. The ones that are the most magical are the nature's meditation. videos. I did nothing on them other than record them for you. This is all nature. Nature is our healer. Nature doesn't expect anything from us. The trees don't stand up and say, oh, I hate the wind, and knock the wind off, or, oh, the human's cutting me down, I hate you. They're just like, okay, just go with it. Nature just goes with it, you know? Let's be like a tree. Let's be like nature. Just flow. Go with it. With awareness and acceptance, patience. Are you impatient with yourself? You want it done. You want it done now. That's common, right? We need to remember it's about the journey, not the destination. The journey is the key. So the two people who passed me on this video, going 15 miles over the speed limit, they're right in front of me right now. They didn't get very far. So check your impulsivity. Slow it down with a breath, and then another breath. Take your time. Be patient with yourself. Don't have expectations. Those are what get us. Expectations. Every day I have expectations. Got to get to work at a certain time. Every single patient has a particular time. But if it doesn't happen that way, I don't go, frustrated, I'm hating this. I don't complain. I just go, oh, okay, whatever. All right. A lot easier that way. It's a lot easier. We impose our own problems on ourselves way more than anyone else. If you're looking outside yourself and saying they're the reason I feel this way, you're giving them the power. Anybody you focus on as it's their fault, you're giving them the power, not yourself. Did you know that? So if you ruminate on pain, this is going to hurt. If you ruminate on someone else is responsible, it's their fault, you're going to hurt. So find a different path. That's what I'm here for, to help you with. Find a new path. A calmer one, more accepting one. The one nature does. Nature doesn't get mad if it rains or it doesn't rain, or if it snows or it doesn't snow, or if it's sunny or it isn't sunny. As humans, we find so many things to complain about when we're given such beauty. And we have so many gifts, so many gifts on this planet. We have so many things accessible to us. Food, water, air, especially in the United States. In other countries, which I've been to and lived in, they have to walk miles to get water and food, and they don't have running sewers, and nobody comes to get their trash. And it's all these little things we're forgetting that we're so gifted to have. And if you're immediately going to what you don't have right now, focus on what you have so you can get more of it. It's true. If you focus on what you want, you'll get it. So if you say, I don't want X, you're going to get that. If you say, I do want Y, you'll get that. I know, X and Y. I could come up with, I want peace. You're going to get more. Pay attention, though, when you want it. So I want this. Focus on whatever this is. Give it like a week, and then check back in. Some people say, well, I forget to check back in. Why? Where is your attention? Is it outside of yourself or inside of yourself? Now, people say, well, like right now, I have to focus outside myself because I'm driving. But I'm also present. I'm aware of what's going on. I'm just like moving through it, step by step, mile by mile. Moving through it. I'm not focused on those two cars back there that passed me that are now gone. It's like, okay, let it go. Whatever. Someone wants to rush, just don't cause a car accident for someone else. That's all. Just be safe and kind to others. And then you're safe and kind to you. The more nice you are to yourself, the more nice you are to others, even if you feel like they don't deserve it, that's not what matters. You don't want bad karma coming back at you. Because it happens. I've seen it. And pay attention. You might see it too. You might have some nasties in your life, some people who seem to get away with everything. That's painful. That's why I'm saying it. It can be painful to watch and be in experiences that you're like, well, why does that person get so much when they're so mean and angry? Oh, you don't know what's underneath. You don't know what karma is coming towards them. So don't have the pain in you because of someone else. Hopefully you've learned some tricks here, some tips. These are things I do that I've been working on for decades. I'm trying to collect it all together in a video. I did spend a lot of money to learn these things. I went to a lot of counseling to learn these things. I was just wanting to get better, be healthy, be well. So, these are the tips and tricks. Do me a favor, if you learn anything from this, will you just type it in? I am just wanting to have that feedback to know how I can tailor videos and information and help others, not just myself. So maybe you like Ben. Maybe you just comment on him looking around. And by the way, when we're calmer and happier, our animals are too. And it ebbs out. People around us are. It's calmer and more relaxed around us when we're that way. So we can help others too. So if you can't help yourself right now, help someone else. And then through that, you'll learn how to help yourself. All right, well, I think I've got enough in for now. And it's been safe. So, namaste.